I am Dr. Rajeshwari, Clinical Head at Oasis Fertility, Banashankari, Bengaluru. Today we will see what are the preliminary tests a couple has to undergo to see if there is any problem for conceiving. What is infertility? It is inability of the couple to conceive after 1 year of unprotected regular intercourse. They need to visit the doctor and have themselves checked. For women who are 35 years and above at marriage, or who are having problems or history of previous surgery on the uterus, ovary or the tube, need to visit the doctor at an earlier date, that is after 6 months of trying. Once the couple come to the doctor, a brief history will be taken, examination will be done, and few simple tests will be done to see if there is any problem in the couple. What is the history? Brief history. A brief history is about their menstrual cycle, whether they are having regular periods, 28 to 30 days, and whether there is any problem during their periods like heavy flow or excessive pain, which may be due to adenomyosis or endometriosis, which may have certain effect on the pregnancy conception. Another thing is whether the couple are having the idea of fertile period. Do they know when they will be ovulating, when they should try for pregnancy to have a timed intercourse? Once the history is done, there will be preliminary examination both for the male and the female. In the woman, there will be thyroid examination to see for any swelling of the thyroid and breast examination for any secretion. Sometimes when there is secretion from the breast, the prolactin hormone can be raised, which can have influence on the follicular development, that is development of the egg and the release of the egg. After this, we need to do a vaginal examination to see for any evidence of infection is one. Second thing is to know if the couple are having proper intercourse. Sometimes there may be problem in intercourse which the couple wouldn't have revealed. Just by correction of that problem for intercourse, couple can conceive on their own. After this, there should be examination of the man as well. That is, he should meet the doctor and have himself examined if there is any swelling of the scrotum or there is any dilated veins, what we call it as varicocele. This can have effect on the semen parameter, that is the sperm count, motility can be affected due to this varicocele heat. After the examination, couple will have certain simple tests. One of the thing is for the woman a pelvic scan. The pelvic scan will usually be done on a second or third day of a period to see for the uterus, what is the size and shape of the uterus. Sometimes there can be a septum in the uterus or a growth like polyp. These all can come in the way of conception. And on either side there will be ovaries. We need to see whether there are adequate follicles, that is the egg reserve, and we also can document if there is development of the follicle and release of the egg. After the baseline pelvic scan for the woman, we need to do a semen analysis of the man. In the semen analysis, we look for the sperm count, motility and morphology. If there is adequate sperm and adequate motility, we will next do the tube test for the women. Tube test is HSG, that is hysterosalpingography. In this, we will inject the dye from below through the mouth of the uterus so that it fills the uterus and the tubes and it comes out. We also will get a certain amount of information regarding the shape of the uterus. Once the semen analysis is done, the woman will have a tube test, that is HSG, hysterosalpingogram. In this, we'll inject the dye from below and take an X-ray. It will show the uterus and the tubes, and the tubes are open. It shows that there is patency of the tube and conception is possible. Once these three preliminary tests are done, certain hormone tests need to be done. That is the thyroid and the prolactin, which can have influence on the follicular development and ovulation. These are the few preliminary tests the doctor will do for you. If everything is normal, they will reassure you and ask you to try for few more days in case you have just been married for a year and the woman's age is below 35 years. If there is any problem found in these tests, your doctor will advise you to undergo further advanced tests to see what is the baseline test and how to go about.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.